This is for educational use only. Our group is allowing our instructor, Mr. Roldan Ardinis, to use this as educational material. We are the group 2 and our topic is all about sexual self. So first, let me give you the introduction of sexual self. So what is sexual self? Sexual self refers to an individual's perception, understanding, and expression on their own sexuality. It encompasses a range including one's feelings, desires, beliefs, attitudes, and behavior related to sexual orientation, identity, and relationship. Developing a healthy sexual self is important for exploring and understanding. Developing a healthy sexual self involves exploring and understanding one's own values, boundaries, desires, and needs within the context of personal and societal influences. This typically occurs throughout one's life, starting in adolescence and continuing into adulthood. Productive system, it means that we can reproduce a baby because our body is fully matured. And next, if there is secondary sex, of course, there is a primary sex too. So the male's primary sex characteristics are penis, scrotum, and the ability to ejaculate when mature. And the female's primary sex characteristics are the vagina, cervix, fallopian tube, and the ability to give birth and menstruate when matured. Development of secondary sex characteristics, on the other hand, this includes the breast development, wipes spreading in female, and for male, facial hair growth, and deepening of voice.
Dexter L. Salazar, and I am assigned to discuss the erogenous zone. Exploring erogenous zones and sexual self-discovery can be an exciting and intimate journey. Erogenous zones are areas of the body that are particularly sensitive to sexual stimulation and can elicit pleasurable sensations. I can share some common erogenous zones that people often enjoy exploring. Number 1, lips and mouth. Kissing, nibbling, and gentle biting can be incredibly pleasurable and arousing. Number 2, neck. The neck are sensitive area that many people enjoy having kiss, lick, and gently touch. Number 3, ears. Ears. Ears are highly sensitive area and can be stimulated through whispering, gently curses, and nibbling. Number 4, nipples. Both men and women can find nipples stimulation pleasurable. Experimenting with different kind of touches, such as gentle licking, sucking, and light pinching, can be enjoyable. Genital area. The genitals area, including the clitoris, penis, and testicles, are highly sensitive and can be stimulated through various techniques, such as touching, rubbing, or oral stimulation. Number 6, inner thighs. The inner thighs are a sensitive and erogenous area that can be teased and cursed to build anticipation and arousal. Number 7, back. The back, especially the lower back, can be erogenous zone for many people. Gentle massage, kisses, or light scratching can be pleasurable. 8, feet. Some individuals find foot massage, toe sucking, or gentle stimulation of the feet pleasurable. It is important to communicate first to have a pleasurable intercourse.
understanding the human sexual response. Exploring and understanding your own social response is an important part of sexual self discovery. Social response can vary from person to person, but it generally follows a pattern also known as sexual response cycle. This cycle consists of four stages: excitement, plateau, orgasm, and resolution. During the excitement phase, sexual arousal begins to build up. This can be triggered by various stimuli such as physical touch, erotic thoughts, or visual cues. Blood flows increases to the genitals, and the body starts to prepare for sexual activity. In the plateau phase, arousal continues to intensify. Breathing and heart rate increase, muscle tension builds up, and the body becomes more sensitive to touch. This stage is often characterized by a sense of anticipation and heightened pleasure. The orgasm phase is the peak of sexual pleasure. It involves rhythmic contraction of the pelvic muscles, intense pleasure, and release of sexual tension. Orgasm can vary in intensifying and duration, and they can be experienced differently by individuals with different genital anatomy. After orgasm, the body enters resolution phase. Heart rate, breathing, and muscle tension gradually returns to normal. Some individuals may experience a refractory period during this phase, where they need time to recover before becoming sexually aroused again. Others may be able to experience multiple orgasms without a refractory period. It's important to note that sexual response is influenced by various factors, including physical and mental health, stress levels, relationship dynamics, and personal preference. Exploring your own sexual response through self-exploration, communication with your partner, and self-reflection can help you understand your desires, boundaries, and what brings you pleasure.
I am Cadet Albarracin, reporting the sexual behavior. Sexual behavior is a complex and multifaceted aspect of human biology. It involves combination of psychological and social factors. Here are some key points about the basic biology of sexual behavior. First, reproductive system. Sexual behavior is closely tied to the reproductive system. In males, the testes produce sperm, while in female, the ovaries produce eggs. During sexual activity, the male reproductive system releases sperm into the female reproductive system, where fertilization can occur. Hormones play a crucial role in sexual behavior. In males, testosterone is the primary hormone responsible for the development of the secondary sexual characteristic and the drive of sexual activity. In females, estrogen and progesterone regulates the man's cycle and sexual desire. Number 3. Brain and nervous system. The brain and nervous system play a vital role in sexual behavior. The hypothalamus, a region in brain, plays a key role in regulating sexual desire and arousal. It releases hormones that stimulate the production of testosterone in male and estrogen in females. Number 4. Response cycle. The sexual response cycle consists of 4 phases: desire, arousal, orgasm, and resolution. During the desire phase, individuals experience sexual fantasies and a desire for sexual activity. Arousal, it involves psychological changes such as increased blood flows to the genitals. Third, orgasm. It is the peak of the sexual pleasure, accompanied by rhythm of muscle contraction. Fourth, and the last, the resolution phase, is a return to the relaxed state after sexual activity. Number 5. Psychological factors. Psychological factors such as attraction, emotion, and personal experience also influence behavior. Factors like sexual orientation, gender, identity, cultural norms, and individual preferences plays a significant role in shaping individual sexual behavior.
Understanding the chemistry of lust, love, and attachment in relation to one's sexual self can be quite complex. So first, let us define lust. So lust, this is a primarily driven by the sex hormones testosterone and estrogen. During puberty, the levels of these hormones increase tremendously, shaping sexual function and activity. For example, a woman with high estrogen may be attracted to a man with high testosterone. Second, attraction. This is related to the reward pathways in the brain and is associated with the hormones dopamine, norepinephrine, and serotonin. Attraction can be linked to lust but can also occur without it. It's important to note that reading too much into a lustful encounter can lead to hurt, anger, and confusion if both partners are not on the same page. Third, attachment. This involves wanting to make a more lasting commitment to your loved one. It's associated with the hormones oxytocin and vasopressin.
Gender diversity is about acknowledging and respecting that there are many ways to identify outside the binary of male and female. Presenting as gender diverse is not about attention seeking or receiving special treatment. It's about being one's authentic self. There is not a need for people to know about every gender out there. What is more important is that people respect those who are gender diverse and the choices they make about their life.
So my topic is all about sexually transmitted diseases or STDs. So these are infections that are primarily spread through sexual contact, such as vaginal, anal, or oral sex. They can be caused by bacteria, viruses, or parasites. STDs can be transmitted through various forms of sexual activity, including sexual intercourse or unprotected intercourse, and sharing some needles for drug use, and even mother to child or during childbirth or breastfeeding. So it is important to note that STDs can also be transmitted through non-sexual means, such as blood transfusions and etc. Some examples of STDs or sexually transmitted diseases are human papillomavirus or HPV and human immunodeficiency virus, which is HIV. HIV is a virus that attacks immune body system, and if it not treated, it can lead to AIDS, which is acquired immunodeficiency syndrome. So currently there is no cure for that. So once a people or a person get it, they have it for life. Protecting yourself from sexually transmitted diseases or STDs involves several strategies. 1. Use protection. Always use a condom during sexual intercourse, including vaginal, anal, and oral sex. Dental dams can also be used for oral sex. These barriers can greatly reduce the risk of STD transmission. Number 2. Get tested regularly. Regular STD testing is crucial, especially if you are sexually active with multiple partners. Many STDs can be asymptomatic, meaning they show no symptoms, so testing is the only way to know for sure. And number 3, know your partner's status. It is important to have open and honest conversations about sexual health with your partner. Both of you should get tested before becoming sexually active. Number 4, limit your number of sexual partners. The more partners you have, the higher your risk of contracting an STD. Being in a long-term, mutually monogamous relationship with a partner who has been tested and is known to be uninfected can lower your risk. Number 5, get vaccinated. There are vaccines available for some STDs, such as human papillomavirus or HPV and hepatitis B. Talk to your healthcare provider about which vaccines might be appropriate for you. Remember, the only surefire way to prevent STDs or sexually transmitted diseases is to abstain from sexual activity. However, if you choose to be sexually active, Following these guidelines can significantly reduce your risk. Always consult with a healthcare professional or personalized advice.
Methods of contraception. Methods of contraception refer to various techniques or devices used to prevent pregnancy. There are two types of methods of contraceptions. Number one is natural methods. So, natural methods rely on timing and behavior. Methods of birth control that rely on avoiding sexual intercourse during woman's fertile period using physical barriers of behavioral methods to prevent pregnancy. These methods typically do not involve the use of synthetic hormones or devices. Number two is artificial methods. So it involves the use of devices, medications, or procedures. It also involves the use of synthetic hormones or devices to prevent pregnancy. So there are several types of natural methods. Number one is fertility awareness. This method involves tracking of women's menstrual cycle to determine when she is most fertile and avoid intercourse during those times. Number two is withdrawal or pull-out method. This involves the man withdrawing his penis from the vagina before ejaculation to prevent sperm from entering the woman's reproductive tract. For artificial methods, there are condoms. These are worn over the penis, inserted to the vagina to prevent sperm from entering the uterus. Number two is birth control pills. So it is an oral contraceptives contain hormones that prevent ovulation or thicken the cervical mucus, making it difficult for the sperm to reach the egg. So number three is intrauterine devices. These are small T-shaped devices inserted into the uterus to prevent pregnancy. They can be hormonal or non-hormonal and work by either releasing hormones or creating a hostile environment for sperm. Last is sterilization. This is a permanent method for contraception, include tubal ligation for women and vasectomy for men. These procedures are intended to be permanent and irreversible.
That's all. Thank you. Mabuhay tayong lahat.